This is Stacy, and we're going to discuss Chapter 1, which is Leading, Managing, and Following. As leaders, managers, and followers, we have a triple aim or a triple thought process in healthcare. We're focused on access, quality, and cost of care. We want everybody to have equal access to healthcare, and we want to be conscious of cost care. But we really focus on quality, and when we're focusing on access and cost, we look at quality the entire time. The Centers for Medicare and Medicaid Services published its quality strategies in 2016, and they listed 6 goals for the delivery of quality health care. And those 6 goals are: number 1, make care safer by reducing harm caused in the delivery of care. Number 2 is strengthen the person and family engagement as partners in their care. Number 3, promote effective communication and coordination of care, which helps decrease cost. I think we're on number 4, promote effective prevention and treatment of chronic diseases. Number 5, work with communities to promote best practices of healthy living and wellness. And make healthcare, number 6 is make healthcare affordable, which is the cost of care. Quality in healthcare means providing care that the patient needs when the patient needs it in an affordable, safe, and effective manner. Quality healthcare also means engaging and involving the patient so the patient can take ownership in preventative care and in the treatment of diagnostic condition. Quality in healthcare context is a collaborative effort that involves the patient, the independent physician, the patient's family, and the community as a whole. So what is leadership? Leadership is the use of individual traits and abilities to interpret an emerging situation and to address this situation in the absence of a script or defined plan. A leadership is not necessarily tied to a position of authority. Each of us have the potential and perhaps a responsibility to provide leadership in a certain area of nursing practice, our institution, and our professional organizations, our community, and our profession as a whole. So I encourage each and every one of you to be a leader. Most of you are probably working in healthcare right now, and you have the ability to be a leader. So let's contrast, what does manager or management mean? It's the act of an individual who guides others through a series of routines or procedures or practice guidelines. It has been asserted that leaders and managers are very different kinds of people. They differ in their motivation, their personal history, how they think and act, how they work towards organizational goals, how their human relationships are, and they differ in their world views. So this slide just helps you differentiate management and leadership. Management is a function. They plan, they budget, and they evaluate. A leader has a relationship. They select talent, or they promote talent in their individual followers. They're motivating, they're coaching, and they build trust. They want the best for their followers. Like as a manager, they're watching for you to make a mistake, and when you make a mistake, you're going to get punished for that. So what is followership, or who is a follower? The best leaders know how and when to follow. So as a leader, we got to have the ability to follow. The optimal use of personal attributes in a team situation while a peer who is leading or managing to ensure the best clinical decisions are made and actions are taken to achieve clinical and organizational outcomes. So to be a follower, it requires active engagement, preparation by group members. Following is just as accountable as leading or managing. Discuss patient care, administrative situations where followership can improve outcomes. So it's important to be an effective follower. Emotional intelligence is what helps people see others in a positive light. In other words, 2 managers could reach the same decision and present the idea to 2 groups. The one with the skills, emotional intelligence skills, could inherit emotional intelligence is likely to be perceived in more positive terms, even though the outcome may be the same. To be emotionally intelligent, you must consider the 5 domains: possession of social skills, interpersonal competency, psychological maturity, emotional awareness, devoted to helping people work well together. So the 5 domains is having self-awareness, means that you can identify the emotions you are feeling and that you know how they are altering your perception. Manage your emotion means that negative emotions such as anger, fear, or passive aggressiveness are avoided. That you can motivate others and motivate yourself suggests that we would be inwardly rather than externally driven. So we are just driven independently versus having somebody drive us. Being empathetic to others and knowing how, when we're empathetic, it suggests that we value differences and viewpoints and we don't side with one group or the other. Handling situations means that we are socially appropriate. We need to emphasize that emotional intelligence is also demonstrated in facilitating the development of these domains in others. So we want emotional intelligence in our followers. So here are the attributes, and I'm going to let you read this. I don't need to read it to you, but here are the attributes of leaders and managers. In addition to being emotionally intelligent, effective leaders and managers must have the above attributes. So now we're going to spend a little time talking about leadership theories. Blay and Coze say that we can divide theory about leading, managing, and following into two categories. The first comprises of leadership theories, and the second is motivational theories. So we're going to start with the trait theory. The trait theory of leadership differentiates leaders from non-leaders by focusing on personal qualities and characteristics. So personal trait theories of leadership attempt to distinguish leaders from other people and identify universal characteristics of leadership. Not surprisingly, no qualities were found that were universal to all leaders, although a number of traits did seem to correlate with leadership. Above average energy, the ability to maintain high level of activity, better education, superior judgment, decisiveness, a breadth of knowledge, a high degree of verbal facilitation, good interpersonal skills, self-confidence is what they found. In addition to the fact that these theories reveal no universal traits among leaders, they also fail to acknowledge the importance of situations when leadership occurs. The trait theory, though, assumes that leaders are born, that they desire to lead, they have self-confidence, that they have relevant job knowledge, that they're intelligent. And there are boxes in your book that talk about leadership, and we're going to write a paper this week on different leadership theories. Style leadership theory does not focus on who leaders are, but rather on what they do. It focuses on task and relationship behaviors. Although trait and skill theories have ideas that can be intertwined and can be compared to one another, style leadership theory differs quite drastically. Instead of focusing on who the leaders are, or what qualities they possess, or were born with, or skills they acquired, style leadership instead focuses on what they actually do or did. Style leadership refers to the behavior and action tendencies held by the leader that led to their individual style of leadership and how it impacted their environment. They focus on two different things. They focus on task behavior and relationship behavior. So task-oriented behavior is their ability to plan, coordinate, schedule work activities to get the job done. Relationship-oriented behavior focuses on relationships with people below, above, and around them. Situational leadership approaches views of leadership behavior as actions that are motivated by a certain situation. There is not one single ideal approach to leading because circumstances vary. So situational leadership theory says effective leaders must change their behavior according to the situation. These particular situational models offer a framework or guide for being flexible and adaptable when learning. And then we talked about transformational leadership, or we will talk about it in one of our PowerPoints this week. A transformational leadership is defined as a leadership approach that causes change in individuals and social systems. It is ideal form. It creates value, positive change in followers, with the end goal of developing followers into leaders. It enacts an authentic form of leadership. It enhances motivation, morale, and performances among its followers. These include connecting the follower's sense of identity and self to the mission, a collective identity of the organization, being a role model for followers that inspire them, challenging your followers to create a greater ownership for their work, and understanding the strengths and weaknesses of followers so that leaders can align followers with tasks that optimize their performance. So there are 4 dimensions to transformational leadership, and I'll let you read this. So they also said that we could look at leadership theories in the regards to motivational. And I'm just going to pull my sheet here on motivational. There's 4 theories, and we'll look through those. Maslow hierarchy of needs. I think that by now you guys know that. That's based on that we got to meet our physiological needs before we can meet our self-fulfillment needs. And we look at that in patient care too, that we have to fulfill physical needs before we can fulfill emotional needs. So you should be familiar with Maslow hierarchy of needs. The 2-factor theory by Frederick Herzberg is credited with developing this theory of motivation, and it was first published in 1968. And its key ideas are that hygiene factors such as working conditions, salary, status, security motivates workers by meeting safety and security needs and avoiding job dissatisfaction. It identifies motivator factors such as achievement, recognition, and the satisfaction of work itself, and promotes job enrichment by creating job satisfaction. Organizations really need both hygiene and motivator factors to recruit and retain staff. Hygiene factors do not create job satisfaction. They simply must be in place for work to be accomplished. If not, these factors will only serve to dissatisfy staff. Transformational leaders use motivator factors liberally to inspire work performance. The expectancy theory was created and developed in 1994 by Verum. Individuals' perceived needs influence their behavior. In the work setting, this motivated behavior is increased if a person perceives a positive relationship between effort and performance. The motivated behavior is further increased if a positive relationship exists between good performance and outcomes or rewards, particularly when these are valued. So expectancy is perceived probability of satisfying a particular need based on the experience. Therefore, nurses in leadership roles need to provide feedback about positive performance, is what this theory says. The last theory, the OB behavior modification, is accredited for establishing the foundation for organizational behavior model based on Skinner's work. This model is an operant approach to organizational behavior. It follows a 3-step model called ABC model, and a leader who uses positive reinforcement to motivate followers to repeat constructive behaviors in the workplace. Negative events that demotivate staff are negatively reinforced, and the staff is motivated to avoid certain situations that cause discomfort. Extension is the purposeful non-reinforcement or ignoring of negative behaviors. Punishment is used sparingly because the results are unpredictable in supporting desired behavioral outcomes. I just got to catch up with you here. In conclusion, managing, leading, and following are all complex tasks that are required to actively assert roles of being an effective follower, manager, or leader. Each is important in creating the whole of the nursing care for patients.